Hi, my name is Katie Freeland, and this is my research project entitled Utilizing Initial Symptom Severity Score as a Predictor for Increased Time Lost After a Concussive Incident in Adolescent D2 High School Athletes. So we evaluated every high school athlete during a one sports season diagnosed with a concussion using the SCAT-5 tool. It's a sports concussion assessment tool, and part of that is daily and initial assessment of symptom scores and monitoring within a time period of about 7 to 10 days, or as long as the athlete is having symptoms. So part of the methods that we use were using this SCAT-5 tool to ask them symptoms daily, having them rate on a scale of 0 to 6, and then also asking them their percent normalcy perceived from a scale of 0 to 100%, 100% being perfectly normal. And as the patient progresses, we'd expect their percentage to increase to a higher percentage and then their symptom score to decrease. So you can use this tool for immediate assessment as well as to assist in the return to learn and the return to play process. We found that the initial symptom score, at least the average, was a 14, and the initial normalcy rating was a 65%. The last reported symptom score average was a 10.5, so a decrease, and the last reported normalcy rating was an 85%, so that did increase. So we would expect to see those. As far as days lost from sport was about 9, and then we saw some patients who didn't really follow the linear trend of their symptom score decreasing and their normalcy rating increasing. We saw some of them have a higher final initial symptom score than their final score versus their initial symptom score, or them having peaks and drops in between. So we would expect these patients to spend more time in the return to play process. So some limitations was we had low patient compliance. We used a pencil and paper on the SCAT-5 forms to record the data, as well as the patients. We relied on the patients to come in and report their own scores. So in conclusion, though, we did find that the higher symptom severity score over a period of 7 to 10 days was correlated with the higher rating of perceived normalcy, and that the higher initial symptom score did equate to a longer return to play process. But at the end, most patients did return to sport within 7 to 10 days. So that concludes my study. Thank you for listening.